Health Services Health Talks. I'm Dr. Joshua Derito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at the innovations in personalized medicine. What is personalized medicine? This is where medicine and the healthcare is specifically tailored to your needs as an individual. There is a shift now from one size fits all treatment to customized care. So we have the use of genetic information and the molecular biology to be able to help diagnose and make a treatment specifically for you. So what are the technologies that are being used to drive personalized medicine? One, there is genes sequencing. This is where your DNA is analyzed, and after the analysis of your DNA, then your treatment will be tailored to your genetic makeup. This will help make drugs that will respond to the disease that you have based on how your body is able to respond to the drug that are going to be used. Then there is the use of artificial intelligence and machine learning. This is where information is used to predict disease risk and optimize therapy. Using artificial intelligence and the understanding of your genetic makeups and your behaviors and your environment, the possibilities of diseases that you are likely to get can be predicted, and the preventive measures are devised based on that. Then there is the use of CRISPR and the gene editing. We have diseases like sickle cell disease. They have been taken through this, whereby the gene that is responsible, the defect that causes the sickle cell anemia, is able to be crisped and removed, and another one inserted, and this prevents your body from making those kind of cells that were causing you to have the sickle cell disease. And this has already been implemented in some countries, and patients who had issues with the sickle cell are living a normal life without having to go through the crisis and all those challenges of diseases. And this is likely to develop further, and will be possibly be used to develop some treatment and even prevent some diseases like Alzheimer's disease. And then there is the use of wearable health technology, where there is continuous monitoring for real-time adjustment. Now we can monitor our oxygen saturation, we can monitor our heart rate, you can even do an ECG on yourself using wearables and communicate this to your doctor, and he can be able to decide what are the likely problems that are happening and even adjust your drugs accordingly. Then there is also the issue of bioprinting and regenerative medicine, whereby tissues now can be used, and the issues of organ creation, so that we can be able to help remove and create some organs and help individuals who have gone through some organ failures. So the use of AI and the big data in personalized medicine. We have AI helping diagnostic faster and giving more accurate results. Then there is the predictive analytics in disease prevention. As I've said before, you have whereby your genetic analysis, your behavior, your environment is analyzed, and then preventive advice can be given. Then there is the role of electronic health records in customizing treatment, use of your information, and this is also making it easier that if you move from one health facility to another, the information that was in your previous facility can be transferred and easily accessed by the other facilities that you are moving to. Then there's the issue of pharmacogenetics, which is whereby the use of genetics is used to influence drug manufacturing and also influence your drug responses. Then you have personalized prescriptions based on the individual's metabolism, and this leads to reduced side effects from drug and also increased drug efficacy. Then you have the CRISPR, Cas9 and the gene therapy, where CRISPR is revolutionizing the treatment of genetic disorders. As I have talked about the issues of disease like sickle cell, which can be now be trimmed and removed, and your normal body structure is reinstated using genetic study, and this is whereby DNA analysis has really helped in the development of medicine. There's the also real world applications in cancer, whereby this will be used possibly in the future, because in cancer there is some possibilities of mutations of some genes which is become cancerous, and these can be detected, and these genes can be cleaved and removed, and the better functioning genes can be reinserted, and you are able to continue with your normal life. Then, of course, there are the issues of ethical and the safety of these consideration, and what would be the likelihood future side effects. We have a personalized cancer treatment, whereby immunotherapy and targeted therapies. In immunotherapy, your immune system is boosted to be able to fight the cancer cells, and this has been used in cancer treatment, and it is working very well. We also have targeted therapies, where specific genes and the specific cancer cells are targeted without involving the other normal cells. As I talked in one of my previous videos, is the use of nanotechnology, whereby the drugs are specifically delivered to the abnormal cells, sparing the normal cells. Then there is the issue of tumor profiling for customized treatment plans, and the advancement in precision technology, whereby drugs are specifically developed for you, and they are based on what is your possibility of your genetic makeup. Then we have the role of wearables in technology, in personalized medicine. We have now smartwatches, which are enhancing continuous health monitoring. We have artificial intelligence powered health apps for real-time interventions, and we have data from wearables which informs precision treatments. You can be able to tell how your blood pressure has been having, and your drug adjustment can be based on that. Moving away from the traditional way where you used to be seen by the doctor every 3 months, and possibly by the end of the 3 months you have developed some complications. So issues of ethical and regulatory challenges, we have data privacy concerns and genetic research. Then you have also the issues of cost and accessibility of the personalized treatment, and also ensuring fairness and in AI-driven health care decisions, so that at the end of it all, the patient is at the center of this care, and he is able to make decisions regardless of what all this technology is predicting. So as we look into the future, we are looking at artificial intelligence powered drug discoveries, looking at expansion of digital health, and also remote monitoring, and also advancements in precision nutrition and microbiome research, so that we are able to improve our health, and also maximize on our microbiome to improve our health care. So personalized care is getting a lot of momentum, whereby now treatments are more personal determined, depending on your genetic makeup and the disease that you have, and this will help much revolutionize the treatment and the detection of diseases, and even in disease prevention. So there's the growing a lot of technology in tailoring healthcare, and I encourage you that you get to enlighten yourself more, and also make your comments below this video on what you think about this new development and the impact they will have on us as individuals, and some of the ethical issues that we are likely to face. Thank you for watching.